The nice thing about non-surgical is there's a minimal amount of recovery. So 20% of my patients, they're indicated for a non-surgical procedure, such as a non-surgical rhinoplasty, a liquid rhinoplasty, or even the facial lift, body contouring, BBL, but without the surgery or the risk of death. So these are all procedures that I do in my practice that are non-surgical, besides my Medi-Spa, where we take care of patients' skin needs within laser.
Amazing. So it seems as if your practice is quite comprehensive in providing patients not only the surgical care and the non-surgical side of it. You know, if I had the possibility to do some surgery, I mean, that would definitely bring in everything in terms of possibilities for my patients. So one thing that you mentioned, now we are going to go back in sort of the breast and reconstructive surgery there, but something that you mentioned a lot, especially in facial aesthetics, which is more relevant to our practice, is the facelift and the neck lift. One thing that I find sometimes challenging, especially for patients a lot of the times, is, you know, when we talk about non-surgical techniques, there's only a certain amount of limit that I believe patients are able to get in terms of lift. You know, like this word gets thrown around a lot in medical aesthetics, this word lift, and sometimes even representatives use the word lift, and it goes with a little bit of an asterisk, to be very honest with you, because you know, as we know, there are certain techniques that could lift, but is it going to achieve a lift as much as an actual surgical facelift or a neck lift? To be very fair with you, I don't believe so. What are your thoughts on that, Henny?
Yeah, absolutely. So whenever I have a patient that approaches me, I like giving them all the options that I can provide them. And I always think about the example of, if you're a hammer, everything looks like a nail. And if you only know how to do one procedure, patient will offer them that one procedure. Like you offer your patients multiple avenues of procedures. This is what I like doing, and I like giving them the option. So for instance, we have a patient that comes in and who comes to us and says, I want this, for instance. So they're lifting their tissue, their face, their neck, they're going like that. So we go for the non-surgical branch, and then we go for the surgical options. In the non-surgical options, we have two branches. We have the fillers, which are biostimulators and hyaluronic acid fillers, and we also have the insta lift silhouette, so with a thread lift. And even within that non-surgical, we go dive deeper, and we can talk about skin quality. And we can even do some tightening and lifting, for instance, with some type of lasers, broadband light, IPL, CO2, and we could kind of do a resurfacing, especially for the eyes, and that does a type of eyelid lift. So it really depends on the severity of the deformity and the sagging that we see in our patients. And it also depends on what they are looking for and what they expect post-op if they have a recovery time. So for instance, today I had a patient who was a cardiologist, and when she came to see me 6 years ago, she works 6 days a week. All her life, she's extremely hard to work, but you see that deflation and weakness, tear troughs, cheeks went down, the skin quality was poor, and she kind of needed fat grafting, which is a little bit more permanent results, and the facelift and the neck lift. But she told me she doesn't have any time for recovery, and the face and neck lift needs at least 2 weeks of recovery. And that by itself tells us, okay, we can't go surgical. Let's speak about the medical. And I can show after for her, if she looks 10 years younger today than she looked 6 years ago. And I think the magic of doing the right treatment for the right patient at the right time. You could give them a minimal invasive procedure, minimal recovery time for the right patient. It doesn't work for everyone.
One thing that I hear you mention a lot is skin laxity, and that's probably one thing that I assess a lot on patients, is that capacity to lift with that skin, because that's sort of like that overlying surface. If a patient has too much skin laxity, I can put, you can do you can do injectables, you can do non-surgical lifts, you can, there's a lot of this talk, especially in social media, of a non-surgical facelift. And you have these stunning sort of before and afters of patients going from, it almost looks as if it's a surgical job, to be very honest with you. Sometimes I do believe that there are limits to non-surgical facelifts, and the fact that you're able to offer facelifts and neck lifts to your patients allows you that extra tool to sort of say, well, if you look at it surgically first, or the patient, well, you can sort of decide relatively quickly if you're going to go more toward the non-surgical or the surgical, in the sense where if the patient already doesn't have a lot of can't have a lot of downtime, well, you're looking more at the more non-surgical techniques, or techniques that have a little bit less downtime. But I will be honest with you. A lot of my patients are looking for non-surgical techniques, but the problem with it is sometimes duration, right? They like the work that's with it, but they like it so much that they want to stay. And if you want to have more long-term results, you're going to have to go into treatments that stimulate more collagen, or lifting treatments, right? So more surgical. And offering non-surgical, even some technology devices, as you mentioned, can certainly help when it comes to the skin laxity. But you can probably Morpheus your face and do radio frequency and micro needling at 10 million times. Sometimes it's not gonna lift like a facelift. Like, what do you think about that?
Well, you're just adjusting that, Alex. If you don't mind, I'll just share with the group the before and afters of what I was just telling about the cardiologist that came to see me.
Yes.
So this is her 6 years ago. You can see you can see the tear troughs under the eyes. Looks kind of tired, fatigued. The nasolabial folds, the cheek fat pads have deflated, the marionette lines, and this is the power of doing specific types of fillers and biostimulators and energy device treatments, and you could really help improve this patient look and feel her best with no downtime. Yeah. So this was the power that you and I, we have for our patients, and that's why we do what we do, because it's so satisfying to give our patients a smile. But you're right, this treatment doesn't last for 10 to 15 years like a surgical treatment does. This treatment, for instance, her tear troughs, we put an HA filler. That lasts around 9 months. For the cheek, because she had a lot of deflation, I chose to do a biostimulator. So we did polylactic acid Sculptra there. And for her, usually it lasts 2 to 3 years. Specifically for her, it's actually lasted more than 4 years. And exception, not the rule. But it saw that her skin quality improved with that biostimulator, which is not something we could do with surgery. So yes, surgery, we could get more longevity of results. We could get more profound results in a shorter time frame, but it doesn't address all issues. For instance, if I could do a face and neck lift, I could give the best jawline definition, and you can check my website with the results that we get. Fantastic with the minimal scars, but we have not addressed the skin quality, which is what you were saying, Dr. Alex. And we need some devices, such as CO2 laser, for instance, and that skin thicker. The facelift doesn't thicken the skin.
Exactly. Yeah. So that's something that a lot of patients sometimes forget, but at the same time, it's our job as providers to give that sort of education that there's the deeper layers, and then there's also the more superficial layers. And since the skin is sort of the canvas that we sort of work on at the end of the day, the quality of the skin overall, the structure of the collagen, the amount of elastin that's within the skin, is always something that I try and educate my patients on. Now, there are so many treatments out there that can stimulate collagen. I even made a video not too long ago on certain treatments that can stimulate collagen. What are your favorite treatments that you have in the clinic to stimulate collagen? You've actually mentioned the CO2 laser. I think that's absolutely amazing to stimulate collagen. I mean, of course, there's a little bit of downtime that's associated to that one, but in terms of collagen stimulation, that one's absolutely great. That's why we call them these sort of like resurfacing layers, because it gives that such a nice new surface after the healing process. So what are things that you recommend to your patients when it comes to collagen stimulation? So we mentioned CO2, maybe some radio frequency. What else do you offer?
Yes. So there's multiple modalities to increase the collagen. And what is collagen for? Basically, collagen is a protein. That's all it is. It's a specific type of protein. We have 4 different types of collagens in our body. We're usually speaking about collagen 1 and 2, mostly 2. Yeah. And that's the reason why we care about collagen is because it's the thickness of the dermis, which is the layer of the skin that creates the fullness and minimizes the wrinkling. And with age, dermis thins out, we lose some of the collagen, and we get more wrinkling, and we get that kind of loss of texture and hydration, because collagen does absorb some of our water, along with hyaluronic acid in the skin. So that's why we need that collagen. We need it for the strength, we need it for the appearance and the youthfulness of the look and the radiance. So number one is, I don't believe in collagen supplements. Now, I'm a physiologist by training, and I did exercise physiology, cardiac physiology, and then I went to the med school. And we learned that when we eat protein, the protein we eat goes into our stomachs, into our intestines, and it gets broken down into, Dr. Alex. So we have 21 amino acids. And then the body decides to put back those amino acids into a protein that it needs. You go work out, you break your actin, myosin filaments in your muscles, you go have a steak, you sleep, and the body forms more actin, myosin, and you get your biceps back and bigger. So it heals the area on the body that needs that protein. So collagen, it just goes in, you break it down to amino acids, and it's not specifically going to make more collagen. Now, there's also collagen in the creams. There's some studies to show that collagen can go through that keratinized layer and can create some hydration, but it will not increase the collagen of the skin. So you need something more deeper. You need a provider to give you these modalities to increase your collagens. For instance, geisha or the swan wands that people use, that will not increase your collagen. And when we talk about device energy treatments, I usually go for mechanical versus energy-based. Mechanical, we're talking about injuring the skin. We want to, so when we work out, we're actually breaking down muscle. We eat and the body forms more muscle. That's how the body regenerates and reforms. And that's what we want to do for our skin. We want to break down some collagen in the skin, create this inflammatory or healing process so that the collagen can be stimulated to be regenerated and become thicker. And when we do, for instance, abrasion, microdermabrasion, or microneedling, these are small, tiny needles penetrating the skin, causing trauma and forcing the skin to heal itself, thus thickening the skin depth, creating more collagen. Now, in the microneedling, at the end of these needles, we could actually put radiofrequency energy. As you know, that's what Morpheus is. So we can add on, piggyback different modalities. So with an energy-based device with radiofrequency, you could put some energy, heat, which burns the inner part of the skin and again forces the tissue to heal and form more collagen. So you form collagen from the mechanical abrasion of the needles and then with the radiofrequency. Also, you could add on biostimulators such as your own platelet-rich plasma. So you can take your blood out, spin it, put the growth factors into that areas where you microneedled, and that will further and improve your collagen formation. Then you have the pure energy devices, such as what you were talking about, lasers. CO2 is an ablative laser. It's one of the strongest lasers we have. 10,600 hertz of wavelength, excuse me. So it's the strongest laser, but the problem, as you hinted before, as a recovery time. In some patients, it could be 2 to 3 weeks. In some patients, just a few days of redness. And it's painful, so you may need some blocks. There are some lasers that are a little bit less painful, but the results are a little bit less. So meaning that you need to do 3 treatments, such as broadband light or IPL, not later, can give you an amazing result, thickening your collagen, even removing some pigmentations and even some rosacea. But the results don't last a year. So that's why you have to do 3 or 4 treatments per year, as opposed to 1 treatment of CO2. So that's kind of, generally speaking, what we talk about with my patients when we talk about collagen formation.
Exactly. You honestly explained it very clearly. One of the things, or one of the ways that I explain it to a lot of my patients is that there has to be some sort of inflammation, quote unquote, in order to stimulate a little bit more collagen. It's a cascade of inflammation that is going to bring more fibroblasts, stimulate those fibroblasts to stimulate and produce that more organized collagen and sort of elastin. And you sort of mentioned the biostimulator, because a lot of the biostimulators, the polylactic acids and things that we're injecting, and they're becoming a little bit more popular. Some of these are causing inflammation in the dermis, or the subdermis rather, to actually activate that cascade of inflammation. And we have been talking, and I know you probably have discussed with some of your other colleagues regarding this, and it's something as a topic that a couple of plastic surgeons in the US have been mentioning, is we've been noticing that a couple of patients who are undergoing, Sculptra, some other biostimulators, some plastic surgeons are a little bit worried that it's going to affect their deep plane facelifts over time. Now, I don't know what your thoughts on it. I know a couple of surgeons have mentioned a couple of concerns regarding that. What have you seen in your practice? Have you done facelifts and procedures on patients with previous biostimulators or fillers? That's a very common question that we get as well, is can we get a facelift or a neck lift while we already have our injectables? So these are all relevant questions for a lot of our patients. So it'd be great if we can have a couple of your insights on that.
Yeah, look, Alex, thank you for asking that question. It's an amazing question because it's the hottest topic in facelift surgery discussions in North America and worldwide, in fact. Now, I just want to back up a little bit, if you don't mind, because I talked to you about energy-based devices. I talked to you about mechanical devices, but I didn't talk to you about a chemical device, collagen, for instance, chemical peels. I don't perform chemical peels in my practice, but we do offer our patients a multiple range of creams that they could use that have a tiny bit of an acid, for instance, retinol, retinoic acid. Those are awesome maintenance collagen formers. So it's not a strong acid that will remove your skin, but it's strong enough that you can apply it every night or every other night, and it will form a thicker skin and improve the fine wrinkles.
I absolutely agree with you. Skincare is something that is also pretty big in our clinic as well, is because a lot of these treatments, I mean, you can definitely go into the clinic and get them done, but if you can stimulate some collagen at home, might as well get that done, right? So you definitely clearly spoke about retinol. There's some other great products like vitamin C. You just have to watch out that the vitamin C doesn't get inactivated because it's a very unstable molecule. But those are my two favorites, the vitamin C and the retinol. A lot of my patients are actually even requesting it. Maybe that's due to TikTok and beauty influencers talking about that skincare so much. But yes, 100%. A lot of the chemical treatments that we do offer, including skincare at home or chemical peels, can definitely stimulate collagen as well.
Yes. So I congratulate you because I love vitamin C as well. So thank you for mentioning that. Now, to answer your question about facelift surgeries and biostimulators. So I have the privilege to be able to perform almost a facelift a week. So it's one of the surgeries that I bring the most. In fact, that's the reason why I went to Harvard. You can see the diploma. Yep. So I went there to learn how to do a face and neck lift very well. So I did. But I guess 10 years after, technology changes, and I went back to the US, to St. Louis, in fact, to shadow Dr. who is an amazing, generous human being, amazing surgeon who does deep plane, and I learned that from him. So I offer our patients both the regular SMAS applications versus deep plane face and neck lifts. Now, when we do biostimulators, just for your audience and our audience to understand, biostimulators are type of fillers, but they don't fill per se. They stimulate your body to form more collagen. For instance, Sculptra or Radius, which is polyallolactic acid or calcium hydroxyapatite, as Dr. Alex knows, it's a product that we inject in the subcutaneous plane normally, not deeper than that, with certain rare exceptions such as cheek and chin and jawline. It's not my preference. And that forces the body or stimulates the body to form collagen. Now, I have performed multiple face and neck lifts with patients that had fillers in them. I've seen silicone from a patient from Syria, injecting silicone in her face. It was not fun to find that during a facelift surgery. Not fun. I see HA hyaluronic acid fillers all over time. I see also biostimulators such as Sculptra, polyallolactic acid, and Radius, calcium hydroxyapatite. Now, when it comes to, for instance, what's not FDA and Health Canada approved silicone, I'm not going to dive too much into it. You never want to put in a product that's not Health Canada approved or not. You have to go to someone who really knows what they're doing.
Don't fully agree.
Dr. Alex, personally, he's an amazing doctor, and you could go to someone like him, who's trained who is ethical and cares for this patient.
And that's a huge point that you sort of bring in a lot of my practices. And I tell this to every single patient that I refer to surgery, plastic surgery. And I tell them, if you're doing a procedure that has, higher downtime, more complications, that you just want to do once or twice, maybe maximum in your whole life, be extremely careful in who you go see. Go see somebody that has experience in their field. Go see somebody that they do this on a regular basis, not somebody that's doing this, once a year type of thing. So the fact that you're doing, facelifts once a week it's a huge amount of volume, which allows you to get that experience in deciding for your patients and explaining to them, well, what are the potential complications and risks regarding those surgeries, but at the same time being able to manage the complications as well. A lot of people see the results. They just don't see the expertise behind a lot of the procedures. So you want to go to somebody that not only can perform the procedure, but somebody that can also manage the complication of every single of that procedure as well. And that only comes with experience, to be quite honest with you. It's only with time that you're going to see a little bit more of these complications within your practice. So even when I just started first injecting, although you could be a great injector and you can say your complications rates are really low, that doesn't necessarily mean anything until you actually manage a complication yourself and deal with it yourself. That's the learning curve is honestly exponential at that point. So for your patients and for my patients, I tell them, be extremely careful who you go see when it comes to surgery and long-term or especially more permanent results. Take a look at the results. Take a look at the testimonials. Take a look at everything that you can possibly look at, because at the end of the day, it's your face, it's your body. There are some serious complications regarding some of these procedures. Most of the time it goes well, but you just don't want to be that case where it doesn't go so well. So yeah, that's my little 2 cents on it.
Yeah, thank you for adding that. This is very important for people to know. I could go on and on and on about, you do this for so long. I've seen a lot of complications that have been done from elsewhere. We all get complications. It's all about how you manage those complications and how many complications you get. And so you want to go that's very ethical, and you have that relationship of trust with them. Just to finalize on the sculpture or the Biostimulators with facing necklace, because it was quite striking the first time I saw a biostimulator in a facelift, whether it's a deep or a regular plane. Because when we do a cannula, for instance, injection, when we put in a round tip needle and we go under the skin in subcutaneous fashion, generally speaking, we're in the correct plane, which is in between the skin and the SMAS layer, which is just of the muscles. But sometimes we do go deep, inadvertently or by accident or on purpose.
Exactly.
One patient, I remember her very well. We did her surgery maybe 6 weeks ago. I lifted her face. She did not mention she had any biostimulators. She left that out of her history, despite us always asking. And I saw it. So when we lift the skin of the face, I saw calcium deposition and very hard, rocky white tissue.
Ooh, okay.
It was a biostimulator, but it was, and you could see it in streaks as if it was injected in the cannula. But what I didn't like is there was lumps, there was like clumps of calcifications. So this injector, unfortunately, was bolusing this product. And you could see the powder, you could see the collagen formation around it. It was unfortunately not done correctly. And that kind of slows down the surgery. It hinders the operation. Obviously, she has an amazing result. I'm very grateful and thankful, thank God, that everything went great. But I had to take extra time, because let's just imagine this is the skin I'm dissecting. One layer superficial, I go through the skin. One layer deep, I'm in the nerves, and the patient gets paralysis. So if you imagine there's a clump of calcium there, you can't know where you're dissecting. It's very difficult to dissect. So you have to kind of go slower. It's something to consider when you're getting your injections. Go somewhere where you know that they are good injectors, because if they don't, it may cause problems in the future. You may not know about if you ever think about another procedure, even if it's not aesthetic. God forbid you're doing a cancer removal and you have to do a flap a rotational flap. The surgeons will get into trouble if you're putting the wrong product in your face, or the right product but the wrong way.
Yeah. So hence the need to still see competent injectors, because I mean, if you've been getting injectables that poorly done injectables, that may potentially affect your outcomes at the end of the day if you're potentially looking for a facelift. That's for sure. Now, out of curiosity, did you know if there was more Sculptra or Radiesse that they had injected? Do you know exactly the product that they had injected for that particular patient?
Yeah, to me, it looked like Sculptra, that patient. Yeah, because Radiesse comes comes ready for direct injection. You can dilute it, it comes ready. But when you inject it, it creates a continuous plane of white calcium hydroxyapatite. It's like a white kind of strand.
Yeah.
If you dilute it, it's still a kind of a continuous strand. With Sculptra, as you know, it comes in the powder form, and you dilute it with water to be able to inject. Now, of course, you mix it. So when you're injecting it, it's not a uniform white injection. It's being diluted in a vehicle of water. So what I saw, Alex, was dots of white in a linear fashion. And that's why lactic acid.
I see. Now, during facelift, and the reason why sometimes some patients might not know this, but all those calcifications, essentially, it can actually affect the field of the vision of the surgeon. It can affect also the outcomes of the surgery. Did you have to sort of aspirate and sort of cut out all of those calcifications? Did you leave them there? What did you do with all the calcifications in the end?
Yeah, so in the areas where she had like a rocky formation, you could tell this patient probably had a deep marionette lines, and the injector just did a bolus there. And as you know, in lactic acid sculpture, we try to avoid perioral areas. Yeah. So this injector not only did it in the perioral area, but also bolused her. So she had centimeter diameter, which is a big deal, of a rock right there. So that's been volumizing her. So I did remove it because I dissected the skin. Yeah. There's a rock just under the skin, like a centimeter. Yeah. So I scraped it off and made it the skin. So I kept some on the under surface of the dermis, and that explained why she had some white pigmentation on the surface. So yes, cut it off flush, and I lifted it. And in areas where I do see a depression, and I've seen this especially with my silicone injection, a patient was injected with silicone. I squeeze out the silicone, they create depressions. I inject them with fat grafting. So that patient tissue, I put fat grafting with platelet-rich plasma to further increase this biostimulation and healing and uptake of their fat.
And you did that sort of grafting in the operating room right then and there, right?
All of my face and neck lift patients get fat grafting. I should never say all, but 99% of my patients.
Most of them do. Most of them do. Now, is that something you find that is a great complement to the surgeries as well? As in, you're finding a couple of areas of maybe some irregularities or some areas of volume loss, and you're adding that sort of fat grafting in, sort of complementary, making sure everything looks good? Or what is the reasoning behind it? Does that affect the longevity? I'm looking at it more on the non-surgical side, so I have a little bit less experience on that.
Yeah. Again, great question, Dr. Alex. So basically, my expertise with fat grafting was sculpting of the breast, especially breast cancer reconstruction. Now, when you do breast cancer mastectomy, the general surgeon goes and dissects the breast off the skin. Sometimes it's an irregularity type of mastectomy. It's not as smooth and regular. You don't want to kind of go back to the skin and remove more, because then you devascularize the skin, dilation, and the skin flap dies, and you get a necrosis as a big wound, disaster. So what we do instead is we reconstruct it either with a flap or an implant, and then we could fat graft. We could sculpt the breast the way we want in the areas where we want. Like breast aesthetic practice, I do fat grafting also all the time. It's just an added benefit. It creates more harmony. I'm able to thicken the skin if the skin is thinner, so you have less deformity. Very similar to the fat grafting allows me to kind of do that as well. It's teardrop. Add fat grafting there. I can add a little more in the cheek. I can put a little bit of marionette lines, create a better jawline with some fat. So similar as what you do when you do or work with a deep injection of a biostimulator, you still want to that as a skin booster on the surface of the skin. So it's like multiple modalities get less results that you want.
That's what I get to hear a lot from your practice is the fact that you have all of those different modalities gives you the opportunity to even bring the results of your patient to the next level, because not only are you providing that surgical expertise, but you're adding up other sort of techniques that you can sort of combine with each other, whether they're surgical or non-surgical, in order to get the best outcome for your patients. Now, as physicians, we always look for the best outcome for our patients. That's for every sort of provider or every ethical provider, to be very honest with you. And that comes with a lot of times with education. And that's why we're on this podcast sort of today, is in order to educate our patients on some of the techniques that certain providers and other providers don't, to really understand, well, what are certain things that some surgeons are offering that other surgeons aren't offering. And that as a provider in the non-surgical field, that's what I look a lot into when it comes to my referrals. Now, the extent of my referrals is also my reputation. That's why the referrals are so important, to be quite honest with you, is because we have a certain expectations when it comes to the results that we do. A lot of the patients that we see at our clinic are looking for natural, harmonious results that make you look more elevated without making you look cheap. And the same things should sort of go when we refer to our patients. So we're not going to refer to surgical centers that, maybe create some results that are a little bit out of touch with, or doesn't align with how we view the beauty. So it's great to see the way you work, and it definitely aligns with our clinic as well. Now, maybe some other surgeons are offering amazing techniques as well, but the fact that you have that sort of expertise to combine treatments is something that's very special that not many clinics offer, to be quite honest with you. So a lot of clinics will be offering, just some injectables, maybe a little bit of laser, maybe a little bit of a skincare, but that's pretty much it. You want to be a little bit more comprehensive than that. And the reason why is because there are certain treatments that are more worth it, in my opinion, to be quite honest with you, and may not be fit for that patient. Now, and I completely agree with you. If your injector, your provider only knows that one thing, well, they're trying a lot of the times to orient you towards that one thing, to be very honest with you. And if they can't, well, hopefully they're going to be able to refer. So having all the tools at your disposition and being a master of all those tools in aesthetics certainly allows you to treat way more patients and instead of being able to refer. So it's a great thing for me to be able to refer to other great surgeons around here, including you, Dr. Sino, for a lot of my patients. Now, one of the surgeries that we might not necessarily have the time to talk about on this session, because I know you have to go soon for another meeting, would be talking about the surgical and non-surgical rhinoplasties. Now, I don't know if you do that many rhinoplasties in your practice, Dr. Sino. Do you still perform some of those?
At least twice a week, actually.
Wow. Wow. Exactly. I mean, I also love doing non-surgical nose jobs because you can clearly improve someone's profile. What's your take on the nose job? Do you still consider the? I mean, when I was going through I'd say quote unquote school when it comes to aesthetics, they always said the surgical rhinoplasty is the gold standard when it comes to reconstructing the nose. What are your thoughts on that?
Yes. So non-surgical rhinoplasty is by definition an off-label treatment when it comes to Health Canada and FDA.
Exactly.
That being said, we take Tylenol for pain as an off-label. So a lot of medications are used as off-label. Just because it's off-label doesn't mean it can't be used.
Right.
So one of the most common injectables fillers that I do is a non-surgical liquid rhinoplasty. It's one of the funnest, most fun procedures that I could do. I love it. I think I'm good at it.
Agreed.
Yeah. And it can really help change someone's life if they're still not ready for a surgical, definitive, permanent rhinoplasty procedure. And when it's done well by a good surgical provider, such as yourself, Alex, I've seen you in multiple teaching sessions, and I know you're always wanting to learn and get better for your patients because you're ethical and you care. You have to go to someone like that because a non-surgical rhinoplasty is one of the most dangerous procedures. Non-surgical fillers can be placed in the face. So the tear trough and the nose has potentially the highest risk of injectables, fillers, HA, for necrosis or blindness. The scale, but it's a real risk, but it's a rare risk when it's done in the right hands. And you want to go to someone who knows how to treat those complications if they ever arise. But it's a super fun procedure to do. It's relatively painless if done slowly and with a numbing cream. The results are within 5 minutes. There's no downtime, as you know, and it lasts for a year to a year and a half. So it's not a permanent solution, but at least it gives people number one, financially ability to get the nose that they want if they cannot afford a surgical, to save up for the surgical practice. And number two, for those patients that don't have 2 weeks of their life to be able to take a break, downtime, non-surgical rhinoplasty is an amazing procedure.
Do you still, do you find that there's a shift towards non-surgical rhinos now more in 2024 versus when you first started practice? I mean, you've been practicing for over 10 years now. And due to the rise of social media, TikTok, a lot of these social media platforms, a lot of people are, it's very popular to get a result quickly. I find that's a sort of new millennial or Gen Z sort of way of thinking. Amazon Prime, you need your result right now, today. I needed my result probably yesterday type of thing. So what are your thoughts on that? Do you seeing a lot more patients coming in for that non-surgical rhino over that rhino?
So yes, great comments. And it's like you said, it is a generational phenomenon. Because of social media, it's become very normalized to get rejection. It's not a bad thing when it's done to the right patient for the right reason. So yes, the problem is not the patient seeking the rhinoplasty, because most patients that come for a non-surgical rhinoplasty is because they need it, because they have this big hump that doesn't match their face or whatever it is. The problem is the injectors that inject, they overdo it. Patients with the lips, and then you have the sausage or duck lip. They create a stigma on fillers. And seeing this also in society, we have more patients coming in. I love doing this. I'm grateful for that. But I see sometimes, many times, I should say, in society and in the street, patients that come in with a nose starting from their forehead down to their tip. Okay, the hump is gone, but now you have a bigger nose. That's very natural.
Exactly.
And that goes back to what you were saying, Alice, is that yes, now it's become more popular, especially in 2023. I saw a lot of it. 2024, like the Fertility lift with the Botox, the trapezius, neck lift. Non-surgical is very common. You have to go to the right person, especially for the rhinoplasty, non-surgical. It's the most complex one with the highest risk of complications. So really go to somewhere you trust completely.
And that's, I find, one of the dangers. I mean, there's certainly a lot of benefits of having these social media platforms and exposing and showing patients what we do on a day-to-day practice. But at the same time, when you have so much of this content, people use that sort of platform as a source of information. And thank God there's providers like us, I would say, that are actually, I mean, we're ethically bound by the college to provide real information. I mean, we're not a beauty influencer. We're not allowed to really give false medical information, or somebody's going to come knocking on my door breaking it down. We are ethically bound to provide patients with the right information for the better of our patients. And one of those things that I tell a lot with non-surgical rhinoplasty is that there is that risk. I mean, if you are a patient that is going to be worried after getting their non-surgical rhino that you may have blindness and it's going to keep you up at night, you are just not a candidate for the non-surgical rhinoplasty, to be very honest with you. I mean, it's a 1 in a million event to have sort of like a partial blindness from filler injection. But if that 1 in a million is a risk that's too high for you, it's probably not for you, to be very honest with you. So the fact that you're able to offer the non-surgical and even the surgical one provides patients with both options, to be quite honest with you. And one thing that a lot of my patients get in terms of questions is the biggest thing, especially in surgery, I'm going to be very honest with you, is downtime and cost. Those are the two biggest questions, to be quite honest with you, downtime and the cost. If it wasn't so much for that downtime and that cost, maybe they would have opted towards the surgery right off the bat. So for some of our viewers, you don't have to necessarily say the prices that you offer for your rhinos, but in Montreal here, in Quebec, in your experience, how much are people charging more or less for a non-surgical rhino, for example?
So I'll be, I'm frank. It depends on. So I charge specifically for the nose by region. So the truss of the nose I charge by region, and the rest of the face I charge by syringe. So syringes at this point, 2024, is $850, and my non-surgical is $1,000.
I see. So that's sort of the range that I've been sort of seeing for the non-surgical nose job, to be quite honest with you. And that comes with, some people sometimes forget that there's a certain price, but there's a price for the syringe, or the price for the assistance, the price for the care. There's a lot of other costs that come into it. But the main thing, to be very honest with you, it comes from the expertise and the results that you're able to get from that same filler, because that same syringe injected by somebody else probably has a different value compared to somebody else, based on the amount of experience that you have doing non-surgical rhinos. I personally absolutely love non-surgical rhinos. I do completely agree with you that I see quite a lot of injectors over-treating the rhino. I actually, when somebody does have a hump, I actually personally ask them if they want that sort of straight look in terms of their nose, or they want to make it slightly natural and keep that a very slight amount of hump left, to be quite honest with you. And there are certain humps that aren't even injectable. If your hump is too high and you know it's going to go all the way up to your forehead, I mean, that shouldn't be injected, to be quite honest with you. That's a surgical nose job. If you can see it from a mile away, to be honest with you. Now, the issue is when injectors are thinking to themselves, well, ooh, I can probably save her a non-surgical rhino, but then you're getting towards that gray zone that it doesn't necessarily look so good. So one thing that I tell a lot of my patients is that a non-surgical rhino, it's meant to make your nose slimmer at the same time, but a non-surgical that's not well done can actually make your nose wider, bigger, over time as well. So there are certain longer-term effects that most people don't even tell you first off the bat. They'll tell you, we can correct that hump, no problem. But that's something that some patients need to be aware about, is that filler over time, especially A fillers, sometimes there's a little degree of spread. Thankfully, in the nose, there's not so much spread. But over time, if you repeatedly inject the nose, you can have, especially not using a very high G prime filler, you'll see that tip of the bridge start widening, and that's a lot of the issues that a lot of my patients do see, and I'm sure you see a lot of that too.
Yeah, I believe if you go slow and you use the right, like as you said, high G prime product, with low integration capacity, you wouldn't see too much of that integration. But if you use the wrong product, 1,000% I agree with you.
Perfect. So I know we don't have too much time, Dr. Sino. I know you have to head out soon. Do you have any sort of closing remarks? Thank you so much, by the way, for taking your time out of your schedule to meet with me today for this. I think some of our patients will find it helpful. Hopefully, we recorded this properly. I'm extremely sorry for the Mac crashing on us. Hopefully, we'll be able to have another session at some point. I know there's a couple of patients that did have a couple of questions, but if you do need to go, Dr. Sino, please do let me know. I might just have run 1-2 questions, and that's it.
Yeah, so look, it's been a true pleasure. I really have fun doing these podcasts, especially with you, Alex is very fun. You're a very knowledgeable guy. The biggest advice that I have to patients is really seek someone that you trust. As you said, make sure that they have the credentials, see the before and afters, make sure that you trust them. Don't go to the first person you hear about, shop around, and then decide to go for that person. If you are really wanting it, make sure that they're ethical. You could always reach us on Instagram or social media, or my phone number. And Alex also, you know how to reach him. He'll show his credentials and his contacts. It's a true pleasure. As you said, I have to now run. I'm teaching 8 doctors advanced lip techniques.
Amazing. Well, thank you so much, Dr. Sino. Unfortunately, guys, we won't have enough time to run a couple of questions. Maybe in the future, we'll run this back and do another episode if we have a lot of interest from a lot of our viewers. I think it's great that you're offering a lot of educational content. I can't wait to see what you have coming in 2024, Dr. Sino. I'm absolutely sure that we're going to see each other at the next aesthetic conference. So I'm wishing you and your team all the best, all the success, and all the health for 2024. And once again, thank you so much for spending the time with me on this podcast.